like to show you a stretch that is really good for those of you that think you may have carpal tunnel, or if you have wrist pain, any numbness or tingling down the arms. Typically for people that are doing a lot of things with their fingers all day or their hands, using these muscles, constantly contracting, and so maybe like doing crafts, anything meticulous with your fingers. I know I do massage therapy, so I'm constantly using these muscles in my forearms, maybe typing, really just anything where it involves using the fingers and overuse of the fingers and the hands. And this stretch will kind of go even into the arm, into the bicep, and into the shoulder a little bit. And what happens when you're using these muscles constantly, it kind of, if you can imagine, one muscle attaching from this joint to this joint, the muscle, the belly of the muscle is right here in the center. When it gets shortened and it contracts, it starts pulling on these joints. All of the tendons that run through the carpal tunnel, when they become so contracted, these muscles become so contracted that they start pulling and constricting the blood flow in that carpal tunnel. And so sometimes you'll feel wrist pain, sometimes you'll feel numbness and tingling down the arm, which can also be coming from all the way up here. The scalene being tight, the pec being tight, the bicep being tight, all of these things being tight are going to kind of contribute to any wrist pain, numbness, tingling, etc. So a really good stretch to kind of open all of this up is to find a wall, and you can find any place. You can do this in the office, wherever you are. You just find a wall, and you're going to point your fingers behind you so that your hand is kind of facing like that, and it'll go on the wall just like this. So you're going to place your hand on the wall, fingers behind you, trying to bring your thumb out as much as possible. So, instead of like this, bringing that thumb out so you get a nice good stretch in here as well. So when you place your hand on the wall, you're going to take your shoulder and bring it up and down the back body. So if you can kind of see the difference, most people will probably start about here. That shoulder joint is rolled forward. If everything is really super tight in here, it's going to cause that shoulder joint to be forward because everything is so contracted. So maybe check out the video on the pec stretches to kind of work on opening this up to allow the shoulder to more easily go back. But for now, we want to try as best as you can to roll that shoulder blade onto your back body, plug the head of the humerus into that joint. You should really feel it just sink in and plug in and feel more stable in this joint here. So you're going to, once you place your hand on the wall, you'll begin to kind of, and you've rolled your shoulder blade back, of course, and you'll begin to kind of open away towards the opposite direction of the wall, and you'll start to feel the stretch from your wrist all the way up into the bicep, into the pec. And again, just like with any other stretch, you want to make sure that you're breathing. Nice, big, full, deep breaths. So as you breathe, the longer you hold this stretch, the more you will feel the muscles to kind of naturally release and let go. You'll feel more expansion. It'll become less difficult to get that turn, to get that range of motion. You'll feel the flexibility start to build in your arm as things release and let go. A lot of times people don't hold the stretch for long enough, so they say that they're stretching, but because they aren't holding it long enough, they're not really getting the full benefits of the stretch. So this is a really great one to just open that up, to allow for all these muscles to kind of let go and release, to create more space in the wrist. And it definitely helps when you're using these muscles all day long. So a quick picture of the forearm. These are some of the muscles in the forearm. And this is what I mean by the tendons running through that carpal tunnel. This is the carpal tunnel here. So when these become contracted and shortened, it'll pull these tendons and things will just become really restricted in here, tight, tense, and that's where that numbness and tingling. This up here is bicep, and again, the tendon passes through the elbow joint here, so same thing as down here. Up here, when the bicep becomes shortened, it'll pull on that elbow joint. It'll also start to restrict the blood flow of the nerve that runs through there. So as you can see, all of these kind of go in and through the elbow. So it's all connected. When you start using your forearm muscles and it pulls down here, it's going to start to pull on the bicep, which will in turn go up the arm and into the pec and start pulling on the pec. It's all related. It's all interconnected. With your having shoulder pain as well, this is also a really great stretch to do, just to kind of help to open things up and help you out with some pain if you're having any pain. So try that out, give it a shot, and see what happens, and stick with it. Make sure you're breathing, hold the stretch for long enough, and you should start to feel better. Thank you.